All right, let's talk about something we all do but probably never think twice about. Swallowing. I mean, we do it thousands of times a day, right? But what happens when that simple, automatic action just stops working the way it should? Well, today we're going to look inside and see exactly how doctors figure that out.
Okay, so here's how we're going to break it all down. First, we'll talk about the swallowing challenge itself. Then, we'll get a camera's eye view of the solution. We'll walk through how the test works, what doctors are actually looking for, and wrap up by weighing the good against the bad.
First up, let's get into the why. Why do we even need a special test for something as basic as swallowing? Let's dive into the core problem. So this is really the heart of the matter. Imagine that simple act of swallowing suddenly becomes a huge challenge. For a lot of people, maybe recovering from a stroke or dealing with other medical issues, what was once automatic is now a daily risky struggle. And there's a name for that struggle. It's called dysphagia. And listen, this isn't just that one time you choked a little because you were laughing. No, this is a serious, persistent problem. If you don't figure out what's going on, it can lead to some really dangerous stuff, like pneumonia or not getting the nutrition you need.
So how in the world do you see what's going wrong inside someone's throat? Let's get to the cool part, the high-tech tool that gives doctors a direct, camera's eye view of the whole process.
And here it is. FEES. Yeah, the full name is a mouthful. Fibreoptic Endoscopic Evaluation of Swallowing. But the idea behind it is actually pretty simple. Just picture a tiny little camera on the end of a super flexible noodle. It gives doctors a literal front row seat to see exactly what happens when you swallow. All live in real time.
So what's the big idea behind FEES? Well, it's all about getting a direct look inside and doing it safely. One of the huge pluses, no radiation. That's a big deal. Plus, it's not just about food. They can see how you're handling your own saliva and even test your throat's reflexes with these little puffs of air. It's pretty comprehensive.
Okay, so who actually needs this test? Let's talk about the people who really benefit from this kind of up-close and personal look at their swallowing.
This test is incredibly versatile. It's a total game changer for patients in the ICU, even if they're on a ventilator. Why? Because the whole setup is portable. They can wheel it right to the bedside. It's also fantastic for checking in on someone's progress to see if their therapy is actually working.
All right, so we get what it is and who it's for, but what's it actually like to have it done? Let's walk through the whole thing step by step so you know exactly what to expect.
It's actually pretty straightforward. First, that thin, flexible scope is gently passed through the nose down to the back of the throat. Then, you get to eat and drink. They'll give you different things like applesauce or maybe a cracker, and they usually color it with a blue dye. That's so it really stands out on camera, making it super easy for the specialist to watch and see where everything goes.
Okay, the camera's out, the video is recorded. Now comes the detective work. What exactly are the doctors looking for when they replay that footage?
So a big part of it is using a scale, kind of like this one, the penetration aspiration scale. A score of 1, that's perfect. Everything went down the right pipe. But a score of 8, that's the one you really worry about. That means food or liquid went into the airway, past the vocal cords, and, here's the scary part, the person didn't even cough. That's what they call silent aspiration.
But it's not just about whether something goes down the wrong way. They're looking at the whole picture. Is there residue, food getting left behind after the swallow? Is saliva pulling up? Is there a delay before the swallow even starts? And they're watching something called laryngeal valving, which is just a fancy way of saying, are the vocal folds closing up tight to protect the airway like they're supposed to?
So FEES sounds like a pretty amazing tool, right? But hey, like any medical procedure, it's not perfect. It has its own set of pros and cons, and it's really important to get a balanced view.
And this lays it out pretty clearly. On the plus side, it's portable, and there's no radiation. Huge wins. But on the downside, there's this weird white-out moment we'll talk about. And you can't see what's happening in the mouth before the swallow or what's going on down in the esophagus after.
So what's this whiteout thing? Well, it's like a camera flash. For just a split second, right when the swallow is at its most powerful, the muscles in the throat squeeze so tight around the camera that the screen just goes white. Poof! The image is gone. It's a tiny blind spot, but it's a known part of the test.
So it's a great test, but it's not for everybody. There are definitely times when a doctor will say, you know what, this isn't the best option for this patient. So when is that?
Well, here are the main things they look out for. If your nose is seriously blocked up or you've just had surgery there, that's a no-go. Same if a patient is really agitated. And while the test is super safe overall, complications can happen, even if they're rare. We're talking about things like a minor nosebleed
or maybe feeling faint, or a quick little spasm in the airway.
And get this, it's not just for grown-ups. With specialized teeny-tiny scopes and a really experienced pediatric specialist, they can actually do this procedure on infants and kids. It gives them an absolutely crucial look at what's going on right from the start.
So that brings us to a final thought. FEES gives us this incredible, direct view of a process we totally take for granted. It really makes you wonder, doesn't it? As these cameras get smaller and the tech gets better, what's next? What other hidden parts of the human body will we be able to see in real time? And how will that change everything?